mentioned the state of Missouri, and they've been partnering hospitals there under Becky Miller at the Missouri Center for Patient Safety. Let's go to her next. But Becky, just a quick refresher. Not everybody fully understands the Missouri Center for Patient Safety. You're based in Jefferson City. We use a little Twitter sort of length tagline to suggest what you are, and we say a statewide not-for-profit organization that brings various stakeholders with a vested interest in patient safety together to aim towards preventing medical mistakes. Is that the sort of elevator speech of what the Missouri Center is?
Yes, that is our elevator speech, and what that means is that, there's a lot of good work that's being done across the nation and certainly across Missouri to improve patient safety, but we believe through an organization like ours, has also been seen with similar models across the nation, that we can learn so much by bringing healthcare providers together to work on these complex issues around patient safety, that we can exponentially improve the safety of care through that collective learning. So we're kind of the body who can reach out to the national programs, bring those resources, information into Missouri, coordinate and facilitate Missouri's healthcare providers, hospitals, and other healthcare providers to come together to focus on those activities together. For example, you may have, even a health system or just an individual hospital that is doing this kind of work themselves, but just think what could be accomplished if we could bring 50 or 100 hospitals from across the state together to focus on an improvement activity, how much more learning there would be. And we've really seen that through our projects that we had across the state, specifically with the CUSP and the Stopping Bloodstream Infections project that we had across the state. There has been a lot of learning to identify where those defects are in the system, as Dr. Barinholtz mentioned, and to share some of those best practices, what has worked, what's worked best to prevent bloodstream infections. So really taking that learning and expanding that is really the crux of our work that we also will be doing with our patient safety organization activities and other work we've done like Just Culture that David Marks and Diane Cousins will be sharing with you.
Can you just put a little bit of flesh on the bones? I asked Judy at the very beginning, Judy Baker, about, practically, there's all the talk, yes, we're doing all of this, we're going to reduce medical errors, medical mistakes, and reduce infection rates. If there are best practices, what are we seeing in Missouri that is making a difference? Can you give us some examples, Becky?
Well, really the most concrete example is what we have been able to do with the Stop BSI project in the Kansas City area, that even though those 15 hospitals in that area had a relatively low bloodstream infection rate, we were still able to reduce that rate by 32%, which translated into healthcare dollar savings, but more importantly, saving lives and preventing bloodstream infections. So we're taking that learning and spreading that now across the state to work with more hospitals to reduce bloodstream infections, and also using that same model to focus on preventing another type of infection, urinary tract infections, that are related to catheter use. So that is one concrete example of what we're doing. There are also smaller projects that we have across the state. One of those is actually focused on the hand washing problem that we have. We're working with a small number of hospitals and a nursing home in the southeast part of the state to implement some best practices around hand washing that's based on national models of strategies to improve compliance with hand washing. So that's another concrete example of...
Okay, can I just stop you there for a second? Because that was brought up by our reporter from St. Joseph, mentioning something as simple as hand washing. But it seems hard to believe that in today's age that is still such an issue. What were they doing differently in some of the, hand washing is hand washing, right? What are they doing differently?
Well, the strategies we've tried to incorporate in our project are from the World Health Organization, but it's teaching when and actually how to do the hand washing during the process of care. And I think what we see happens in healthcare settings is, there's a lot of activity that's being done. There are a lot of health professionals that are in and out of the patient's room, and sometimes those steps are missed. And so this is a strategy to try to remind all healthcare professionals when they need to wash their hands, and also educate patients to know that they should be seeing their healthcare professionals washing their hands before they touch them and as they're leaving the room.
Dr. Berenholz mentioned that there were Missouri hospitals, and you were leading this effort with his CASP program, the Comprehensive Unit-Based Safety Program. We heard some of the results of that in other states. Has there been a reluctance, though, Becky, for hospitals to say, yes, I want to be part of that?
You know, there has been somewhat of a challenge, and from what we hear from the hospitals, there are a lot of pressures on hospitals and other healthcare providers now with limited resources to work in these projects that are voluntary. And each one of them have their own priority areas and high-risk areas of where they really need to focus their efforts. So they do prioritize those efforts. Those that have worked with us, I think, have identified that they would specifically like to work on bloodstream infections or improving urinary tract infections as a group with us. Others have decided to do that perhaps individually at their own organization and focus on other priority areas. So, you know, as you mentioned, this is a voluntary program. So I do think from a voluntary approach, I have actually been amazed with the amount of participation we've had in all of our projects that we've had across the state.
The other thing is we focus so much on hospitals, and I certainly do. When I think of medical errors, medical mistakes, I'm thinking of the doctor, the surgeon in the hospital setting. But a lot of errors, mistakes are happening at a different level. Ambulance drivers, the emergency responders. You're engaged in that effort too, aren't you?
Yes, we are. We have a very exciting program that we have with Missouri's ambulance providers. We're working with them as a patient safety organization, and we are also working with them to do some training around establishing a culture for patient safety to help Missouri's ambulance providers understand what that culture is and to encourage their reporting of the types of medical mistakes that happen with ambulance providers. Also through the PSO, we will be providing them a way to report those types of errors into us so that we can learn what mistakes are happening and why and how to prevent them in ambulance services as well as the other healthcare providers we're working with as a PSO.
Okay. Becky's going to be staying on the line with us so we can have some more questions when we hear from some of the other speakers at the end, okay?